this video about why Okinawan population lives so long despite they rely on carbohydrate rich diet, which theoretically from my viewpoint is unhealthy. So what is the secret? And let's go. So if you watched the short video, you know that this nattokinase and serotinopeptidase these fibrinolytic enzymes, and you can buy them. They're available as dietary supplements, and I recommend to use them, especially if for people who rely on this carbohydrate rich diet. Okay, but let's go to more details and more slides. So nattokinase, we call it NK in next, is an enzyme derived from natto. It is fermented soybean food, which is popular in Japan. It is a single polypeptide chain of length or size 27.7 kilodarcy. Its optimum pH for activation ranges from 6 to 12. So now it is actually the alkaline, but it also works at neutral acidity. NK is used as is in treatment of tuberculosis, cancer, venous and arterial thrombosis, fibrillation of the heart, and quite many applications. It has a low oral bioavailability, only 0.2% in humans, due to its instability in the stomach in the acidic environment. The diet high in carbohydrates leads to the destruction of glycocalyx, which is a protective layer on the inside of the blood vessel. I was talking about this previously, and again, destruction of the glycocalyx is a cause of thrombosis, actually. So, and therefore, there is an increased risk of blood clots or thrombosis, and the development of atherosclerosis. NK and SP both, they are fibrinolytic enzymes that dissolve blood clots and reduce the risk of thrombosis. Serotinopeptidase is SP, we will call it next SP, and 4560 kilodarcy zinc metalloproteinase produced by bacteria in silkworm guts. It has higher bioavailability than NK, which is up to 55% in humans, and it demonstrates high efficiency in removing blood clots. You can get it from food, but you cannot get it from food, but only as a supplement. On a high-carb diet, people often suffer from the accumulation in their brain of amyloid fibers in the form of plaques, and the development of various neurodegenerative diseases. Sorry about this noise. I'm just staying in a village, and it's a little bit noisy here. The destruction of these amyloid fibers by enzymes NK and SP has been demonstrated in vitro and vivo with zebrafish model. This SP demonstrates a better ability to dissociate amyloid than NK. So SP can help with various conditions such as pain, inflammation, and various respiratory conditions. So you can really go and read the scientific publications. Okay, here it is how this nattokinase work, and you see it is the best among other enzymes. It is reducing very quickly, reducing number of these fibrils. So it works very well, but SP, this serotinopeptidase, works even better. NK and SP are activated in alkaline environments such as in small intestine, also referred as small and bowel. The enzymes may support digestive health by aiding in the digestion of proteins when the acidity in the stomach low. So if in older age the stomach produces less acid, these enzymes reduce the production of bacterial toxins from proteins by pathogens in the colon. So these supplements have to be designed, but to stay in even not very acidic environment, they have to be designed with coatings that resist digestion in the stomach and break down in the small intestine. where they can potentially exert their effects. And if you buy supplements, they normally have this such special coatings. This SP enzyme has a higher oral bioavailability than NK, and as I was mentioned before, up to 55% in humans, which may be due to its stability in the stomach and enhanced permeability across the intestinal wall. So what is happening if you don't digest proteins? If acidity in the stomach is low, the undigested proteins go to your guts, and to your gut, and then this pathogens use it as a food, and they produce a lot of toxins, so you have inflammation and development of leaky gut syndrome. But if you have these enzymes which help to digest proteins, then it is actually much better. Okay, under normal conditions, our blood has pH in the range of 7.35, 7.45. Arterial blood is more alkaline. The optimal pH range for NK enzyme activity is typically in the range of between 7 and 9, so it works in blood, and which is slightly alkaline, so it works both in arterial and other blood vessels. In the optimal pH range to activate SP enzyme is usually between 6 and 8, which is slightly acidic to neutral. So it is neutral. Yeah, it is. I cannot say it alkaline. 8 is close to neutral. It is important to note that these enzymes can retain some degree of activity within a broader range of pH, but the activity is typically highest within the specified optimal range of pH. Enzymes like NK and SP are target specific in their actions. Natural silk produced by silkworms consists of fibroin protein, and SP degrades silk by breaking down the peptide bonds between the amino acids in the silk fibroin protein. This process effectively digests the silk proteins, causing them to lose their structural integrity and strength. This SP enzyme acts similarly on the cross-link fibrin polymer in blood clots, because its structure almost the same, so it is destroying this fibrin polymers also. This process disrupts the structural integrity of the blood clot, and it becomes more susceptible to clearance by the body natural mechanisms. Some research suggests that SP enzyme may help in wound healing, and indeed it helps. The pathological report of diseased patients with COVID-19 shows signs of thickening of blood vessels and microthrombosis. So it is actually, as both NK and SP can dissolve blood clots, it is possible that NK and SP supplementation will help to significantly reduce the mortality of people with COVID-19 disease or after vaccination. So it is recommended, if you got vaccination, it is use these enzymes, and better to change to this ketogenic diet also. In addition to these valuable benefits, there are other uses attributed to NK including the treatment of hypertension and Alzheimer's disease, but actually both NK and SP enzymes can be used for this. So this is a picture of blood clot. So you see that it is dangerous actually, but with these enzymes, it can be dissolved or destroyed, and then it is reducing risk of the death. SP enzyme has a high potential to reduce chronic inflammation and improve microcirculation of blood in tissues. It acts as an anti-inflammatory agent by regulating inflammatory cytokines. So it significantly modifies cell adhesion molecules that guide inflammatory cells to the sites of inflammation. SP is known as to dissolve atherosclerotic plaques by breaking down fibrin and other dead or damaged tissue. So you see, it is a really good enzyme. Sorry about this noise. Okay, so I would recommend to use it, this SP enzyme. It is good. It is good. I produce myself some enzymes which are working nearly the same or maybe better, but SP, yeah, it is available. Why not to use it? It can also remove deposits of fatty substances, cholesterol, so-called cholesterol, but it is actually oxidized, oxidized lipoproteins. But okay, it can clean, or at least can help to clean this our blood vessels from deposits, and also it can destroy cellular waste inside the arteries. So it is good, it works good, so I recommend it. Even for with ketogenic diet or carbohydrate based diet, it is highly efficient. So it promotes wound healing and reduces inflammation in the wound. It should be noted that this SP enzyme is more stable and it has higher efficacy when used in combination with metal ions like zinc and manganese. Okay, so it's again question of supplementation. It's how to combine them with this zinc and manganese. So it is important to note that potential beneficial effects of NK and SP enzymes typically become evident with prolonged usage every day for years, or maybe for months. My enzyme works normally, you will see improvement in 2 months, but everyday uses, and it is supplements about 1 gram per day. But it is not enzyme, it is actually a supplement which comprises enzymes. Okay, moreover, in healthy older adults, the advantage of supplementing with NK and SP enzymes may be not seen. Again, these enzymes are not very strong, but I would recommend, if you have money, you better use it, at least this SP enzyme. For instance, in clinical trial involving 265 participants with an average age of 65.3 years, investigated the impact of oral NK supplementation compared to a placebo on individuals at low risk of cardiovascular disease. The study findings indicate that the supplementation has no effect on the subclinical progression of atherosclerosis in this specific population. So if you are healthy, you will not see impact. But again, I believe that it is, again, if you have enough money, better maybe use. Another study examined the use of NK enzyme in portion 160 milligram in patients with ischemic stroke and compared it to other anti-thrombotic drugs like aspirin, salicylic, okay, it's aspirin, 100 milligram, or other drug which is clopidogrel, okay, well, okay, taken daily. So of course, this aspirin has side effects, so it is not recommended to use it, especially every day. But this enzyme has no side effects, so it is the advantage. After 6 months follow-up period, no statistically significant differences in vascular complications affecting the brain and heart were observed between the two groups. But again, these enzymes, they are not very strong. They are not very strong. It takes longer than 2 months and even 6 months. It takes years. But if you have money, maybe use it. Results of this trial show that NK supplementation has a no effect on the subclinical atherosclerosis progression in healthy individuals at low risk for cardiovascular diseases. These results emphasize the need for further research and a cautious approach to the use of these enzymes in different clinical contexts. Again, I rely on enzymes myself. I use this, but I didn't see any improvement, so I gave up. But probably I've won, and I will maybe add this SP, at least this SP enzyme. Okay, you have references. You can go to scientific publications, read more. I changed my mind actually when I prepared this presentation. I changed my mind. Previously, I was not negatively, but I was thinking it is useless. to waste money on these supplements, but now I think why not? Maybe it is okay. Maybe it is okay, and so I will use it. Maybe this SP in doses. It is the doses are very small, so it is affordable. Okay, then again, I present my opinion, and my opinion that the basis of the radical lifespan extension is the ketogenic diet with fat and protein of from animals. Butter is the best source of fat, for example. And then if you follow this diet, you can go a little bit further using enzymes, and I produce enzymes myself, but also you can buy this fibrinolytic enzymes and use them, and they are affordable. As for NK, again, you need high doses of NK. These people in Okinawa, they live long because they consume a lot of this natto, a lot. So trust me that it is very important. But also, if you buy this natto, not the enzyme, but this soybean, fermented soybeans, they are not as efficient as supplement. Better to buy as supplement. So it is supplements. It is produced by in bioreactor, and it is purified. It has some coatings, and so it is better rely on producers. Okay, then again, I hope you enjoyed this video. If you want to suppress my channel, press like and bell buttons. Subscribe to my channel, put some comments and questions if you have, and have a wonderful day. Ciao, ciao.